Have you ever been in a situation where you've been around children, your children, possibly friends or your sisters or anyone else's kids that have been in a situation where they're choking and you did not know what to do? Well, today I'm going to talk to you about how to help a child that is choking or not breathing. I am credible to speak on this because I have over 5 years of CPR and first aid experience due to my job. One of the perks of getting trained in CPR and first aid is they also train you on not only on adults, but they also teach you how to help a child. So today I'm going to be using this doll here. My wife said I couldn't use my 1-year-old, so I'm going to teach you what to do if this child is choking. So the first thing you would do with a child that is choking is you would do the Heimlich maneuver. Now it's not your typical put your hands behind the person and bear hug them type of deal. What you would do with a baby is you would take your 2 fingers, your index finger and your thumb, and you would support the chin, and then you would lean the baby over and you would just hit upwards on the baby's back and push up. Now, if you continue to do that and there's no response from the child, you would at that point flip him or her over and lay him down. Be careful you don't hit their head. You want to make sure that you got to be fast but gentle enough that you're not going to cause other problems. Now, the first thing you would do again, there's no response from doing the Heimlich, so you would tickle their foot to see if there's consciousness or not. An adult, you would tap or shake. A child, you cannot. You just would tickle their foot, tap their foot, because that's how you would get their reaction. If there's no reaction at that point, you would then take 2 fingers and you would put them right on the baby's sternum. Now, for a more controlled compression, you would take your other 2 fingers and put it on top. You would then compress 30 times. Now, after 30 compressions, you would then give 2 breaths. But because of the fact, if there is something blocking the baby's airway, and you were to give the breaths, you would blow that right back down. So what you would do at that point is very gently put your finger under their chin and tip their head back, and you would look to see if there's anything blocking the airway. If there's not, you would then give you the 2 breaths and go back to compressions. Now, one of the most important steps before any of this, you would have somebody call 911. Most everybody today has a cell phone. You would need to, jump on the phone, start your compressions, and you would do those compressions until either an ambulance arrives or you have a response from the child. So now after you're doing your 30 compressions and you get your response from the child, you at that point pick him or her up and hold and pat their back. At that point, you would still want to, when the ambulance arrives, speak to the EMTs. You would tell them what you did, make sure that they know what you did, so they can put that in their report to say, hey, the baby was revived, there was choking, there was loss of consciousness, loss of breath, because the doctors do need to know that. So now that you know what to do if a child is choking, not breathing, it's a good thing to have. I would suggest that you all learn, whether you have kids or not. If you plan on having kids later in life, it's something to know. I'm a father of 5 kids, and I can tell you how many times my kids have choked and I've needed to use this procedure is multiple. So thank you.